Hello, my name is Imari Watson, and I am the Communications Assistant for NACHW, and I will be your moderator for today. I hope you've had a wonderful time thus far at Unity. First, I would like to welcome everyone to Session E, Workshop 4, and then introduce our speakers. Our first speaker on today, is Ms. Monica Garcia. Monica Garcia joined MHP Salud in 2021 as Program Director. She is responsible for delivering consultation to federally qualified health centers across the nation that are starting or wish to strengthen their own community health workers program. Monica's 12 years of professional experience in private and nonprofit sectors has spanned borders and strengthened community health equity initiatives in underserved communities globally. Ms. Garcia holds an MA in Latin American and Border Studies from the University of Texas at El Paso, and she is located at MHP Salud's West Texas campus. Our second speaker on today is Keara Redela. Ms. Redela is currently the Community and Public Health Program Supervisor for the Immigrant and Refugee Community Organization. She earned her Master's of Public Health in Global Maternal Child Health from Tulane University School of Public Health and Tropical Medicine. She holds her Bachelor's of Science in Community Health Education from Portland State University and was part of the second We Are Health Afrocentric CHW training. Keara is a Black, queer woman who is committed to redressing the social determinants of health affecting her communities, utilizing the community health worker model, popular education philosophy, and racial equity lenses. She has held various roles in her 19 years in the health field, and the honor of championing the CHW profession and contributing to the creation of Assessments Toolkit to support CHW's professional development through her role on the National Community Health Worker Core Consensus Project, Phase 2 Assessment Advisory Group, and the CHW Common Indicators Project. Our third speaker today is Victoria Adewumi. Ms. Adewumi is an equity communicator and network leader, supporting neighborhood-based interventions for community health and well-being. Victoria works as the community liaison / community health worker for the City of Manchester's Health Department and was part of the first class of trained community health workers in the state of New Hampshire. For her entire career, Victoria has connected historically marginalized communities with greater social, physical, and environmental supports to facilitate resident self-empowerment. A New Hampshire native, Victoria holds a BA and a Master's in Political Science and International Affairs from the University of New Hampshire and is a Johns Hopkins Bloomberg Fellow currently pursuing an MPH in Adolescent Health. I now pass the mic over to Ms. Monica Garcia.
Thank you, Mari. So I want to welcome everybody to our presentation today on Community Health Worker. It's a career web in support of CHWs. Thank you for attending our session. And like I was said, my name is Monica Garcia and I'm the Program Director with MHP Salud. And I'll be presenting with my colleague, Jose Rocubo, who is here presenting with me. He's a certified CHW in the state of Texas and has recently started his new role with MHP Salud as a curriculum and workforce engagement specialist. The purpose of this presentation is to provide CHWs with a resource, a career web resource, a career web model, and links will be available at the end of the presentation for further review and can be accessed. Next slide, please. So let's begin with an overview. In this session, we can expect to answer the following questions. How does one become or develop a CHW? What are career paths and choices along the CHW career web model? What are the results of a national survey on CHWs on current and future careers? Next slide. So let's begin with a reflective dinamica. MHP Salud, we base our trainings on popular education and participatory learning. So of course, in this virtual platform, we do whatever we can possible in order to contribute to that. So in this icebreaker, I'd like for you to close your eyes for 30 seconds as you think about what you would like your career to be 5 years from now, 10 years from now. We recognize that everyone in this session right now is at different paths in their career, and that's okay. We all learn different experiences we each love. So I'm going to start now with the 30 seconds, and I'll tell you when your time's up. Okay, you can open your eyes now, and we can continue with our presentation. I hope you were able to reflect and see, and we will help you through this process on visualizing your career for the future. Next slide. So at MHP Salud, we're a national nonprofit organization with over 35 years of experience developing, implementing, and evaluating community-based, culturally tailored community health worker programs, promotoras, and promoting the CHW model through training and consultation services. Our mission is to promote the community health worker program professionally, nationally, as a culturally appropriate strategy to improve health and implement CHW programs to empower underserved Latino communities. Next slide. So we'll begin on looking at what it takes to become a CHW worker or develop as a community health worker. Next slide. As CHWs, as trusted members of the communities, CHW roles have many intersectionalities with professional career pathways. Here are a few examples. Cultural mediation. CHWs understand community perspectives and cultural norms. They also culturally appropriate health education. They also promote health, disease prevention, and health condition management that is culturally and linguistically appropriate. As care coordination, case management, and system navigations, they make referrals and provide follow-ups. Coaching and social support, they motivate people and access care and services. Advocating, they advocate for clients and communities. Build capacity to address issues through training, CHW peers and among networks. Individual and community assessments, they participate in holistic individual and community level assessments. In outreach, they do recruitment of individuals. And evaluation, they have the capacity to collect data and to share results and findings. So the career trajectory for community health workers is diverse, as we see here. It includes pathways both within the CHW profession and extending into related professional pathways such as education, advocacy, social work, and clinical careers. Next slide. So these are the pathways on becoming or developing a community health worker. These are a few models of ways that community health workers can integrate themselves. One would be direct hire. There are certain qualities associated with the CHW role. It may not require formal training. So leaving an opportunity for individuals to be directly hired into a CHW position. It is common for the hiring organization to provide specific training and in some cases offer hired CHWs an opportunity to become certified if it is available within their state. We also have the training program. So training programs are conducted by government agencies, CHW associations, academic institutions, and nonprofits like ours. Training tends to focus on the core CHW skills such as communication skills, cultural competencies, and/or service skills. We also have certification. Some employers have begun incorporating it as a requirement for employment. However, standardization has not happened across the profession. Certification credentials vary by state. We also have internships. Internships typically fall in conjunction with stated academic goals needed to complete the discipline of study. They are a common tool offered by academic institutions on a short-term basis. Apprenticeships. Typically, they are longer than internships and provide education more specific to the CHW role through on-the-job training and education in formal classroom settings. Additionally, apprenticeships may provide some sort of incentive or wage. Next slide. So here we have, we'll begin with the CHW career web model. So the web model is this, it's a traditional career ladder. It indicates a series of steps, as you see in the platform here, that may take an individual professionally, grows within their specific classification. This method is better suited for specialized positions and may not be suited for the complex career path of community health workers. Ultimately, the shape of the model resembles a web-like, which we see to your right. This web-like structure and falls under the term career web. A career web is a configuration of a career ladder that permits vertical and horizontal movement, placing countless jobs on the CHW career path. Next slide. Each career path is classified in 5 categories here, which are clinical work, social work, education, CHW management, and advocacy. These categories are intended to help individuals recognize the direction they would prefer to take in their career based on the work they prefer in the CHW role. There are many elements beyond enjoyment that factor into one's decision to start a new career path, such as compensation, education requirements, and scheduling. And as we see here, this career model can be a component for a CHW workforce development. We also see this career model to be one of the steps in initiating and developing, defining, to solidify a career CHW workforce. And the function of this model is to assist in conceptualizing the many paths that CHWs can take during their career development. Next slide. So we now go where we will look into career paths along the CHW career web. Next slide.
Okay, thank you very much, Monica. So what I'm going to do, I'm going to be presenting on my personal career web experience. So I do have over 6 years of CHW experience in different areas within the career web, but I do want to add, though, that a lot of this work that I was doing before, I didn't know it was even related to being a CHW, as many people are also not aware that part of some of these positions that they've been in is part of the CHW career web. So many times we do see CHWs as someone who is just conducting outreach. And I know the definition for CHWs, we all know that they're a community health worker is a trusted member of the community who empowers their peers through education and connections to health and social resources. So there's so many job titles CHW can have or also could serve as part of the job description. So my career as a CHW prior to knowing I was a CHW or I was conducting this type of work was as an eligibility specialist for a health system organization. We would conduct outreach to patients to assist with state health insurance applications and determine qualifying factors and eligibility. So you can see that's on the green side of the career web. Because of this experience, I was able to also become a case manager for patients seeking additional resources with other organizations and following up with them. A few years later down the line, I had an advocacy role working with eligibility benefits for immigrants within an organization based on state criteria. So this involved being a voice for the specific community that needed the help. Later down the line, I began work conducting outreach for different programs, such as one of our programs with MHP Salud in Texas, the Navigator program. So of course, this consisted of conducting face-to-face interaction. This could be in health fairs, community centers, and events, helping people find additional resources and applying for benefits they could be eligible for, as well as helping with appeals on applications and determinations. Within this role, also, I did become the lead CHW for our outreach territory here in Texas. Within the organization, also, I was able to move to a CHW resource specialist position, which would help give the CHW perspective on certain topics and ways to reach the community and educate them as well. I would be participating also in technical assistance calls and collaborative resources. So you can see, I've been moving from the green area in social work over to the orange, the blue, and also now in the brown area. Right now, currently, my role as a curriculum and workforce specialist does focus on groundwork with CHWs and making sure that we're able to holistically provide services, as well as making sure CHWs have adequate training within the specified program that they're a part of. So right now, as you can see, the career web does have different descriptions of what a CHW is, and also you can see how one can move throughout the career web. So there are possibilities to move right across, for instance, eligibility, specialist to health educator based on training, or even an advocate to a registered nurse, again, all based on education and training. Also, as mentioned, there's opportunities to still keep moving within the web. Once you're in one area doesn't mean that you would just stay in that area. There's always room for advancement. And this is my personal experience with the career web as a CHW.
Thank you, Jose. Next slide, please. So we'll see here on some of the career paths, as we heard with Jose, the web is versatile and it's malleable, which you can go in different directions. Whether if you go on a ladder, it always is a upward movement. And with the career web, the CHW career web, as we know with CHWs, they're versatile. They can go into clinical work, they can go into social work. CHWs can go into education or CHW management or advocacy, which includes lobbying for specific needs in their communities. And this is why this web is so important, because we're able to see the specialized effects that CHWs, the talents that the CHWs have, and the areas that CHWs can really grow into. So let's look at, the next slide, please. We will look at some of the areas that highlight some of the areas that are listed here. We will do the first three. We will start with the clinical path. So the clinical paths that fall in this category are ideal for CHWs who enjoy the clinical responsibilities of their work. And these are responsibilities associated with clinical work that fall under the CHW umbrella, include health screenings and care coordination. So as we see in this model, there is the intersectionality between the community health worker and the clinical work. So some of those within these classifications or within these clinical works, there are certain degrees that are certain jobs that can be obtained. So one would be nursing. This path is suited for CHWs who enjoy performing health screenings, assist patients, and work in a clinical setting. We also have dietitians and nutritionists, which is a natural transition for CHWs who enjoy promoting healthy living. We also have phlebotomy. The career paths within the clinical classification commonly require additional education, certification, and licensure. Next slide. And now we have here social work. We also see that CHWs also have these intersectionalities working in the community as social workers. And so these career paths fall in this category are ideal for CHWs who enjoy providing social services in the community. They can include CHW responsibilities such as linking community to resources and providing social support. There are two main career paths here. There's direct social work, which typically operates in the community space and is a good career path for CHWs who enjoy working in the community. There's also clinical social work. It requires additional schooling and credentials, and work is typically done in a clinical setting. Next slide. Now we'll look at education. So as we see, CHWs also engage in education within their communities. They provide linguistically and culturally appropriate information, and they also provide education that is tailored to the population by age, ethnicity, familiarity to the topic, among other things. So among this field, there are three distinct career paths and classifications that a CHW can obtain. It would be a health educator. In this career path, incorporates education while remaining within the health field. This path is ideal for CHWs who enjoy educating the community on various health topics. We also have a traditional teaching role. This career path incorporates education work, but is specific to youth population and shifts from the health field. And we also have corporate trainer. All paths in this classification require additional secondary education, which is an important consideration for CHWs looking to develop within these professions. Next slide. And here we have a few of examples of these career paths that we talked about, and with specific examples on clinical paths, social work, education, CHW management, and advocacy. Next slide. So now we want to also introduce you to a national survey that was conducted by MHP Salud. It was completed by 405 individuals with a total of 345 individuals identifying as CHWs. The purpose of this study was to help inform the creation of a CHW career ladder and advise on the gaps for future training and education models for CHWs. Next slide. So in this national survey of 405 individuals, it was conducted in 2019 on the current and future careers for CHWs. Out of 405, 354 identified as CHWs. The age range was between 40 and 59. 43.7% of the participants reporting 5 or more years of CHW experience. New Mexico was the most common state of employment, followed by Texas and Missouri. Most participants of the 354 reported receiving formal CHW training. And also interested in additional training, we had 86%, which was 279. And also interested in formal education, we had 74%, which reported yes. Next slide. So this is a training word cloud. And so these are some of the words that came up during this process of this report. And it indicated that these are the words, or these are the training areas that CHWs were interested in obtaining more training. We see supervision, mental health, chronic disease health educator, more training on diabetes, leadership, social work, trauma. So these are things to think about if you're considering a future career, or if you're a CHW supporter, to consider this for training for your CHWs. Next slide. Now the education word cloud offers an insight into those professions that CHWs are interested in beyond their current roles. And we see health educator, social work again, public health, nutrition, medical assistant, substance abuse, master's in public health, nursing, and health coach. Next slide. Any questions? Next slide. So here we have a few of MHP Salud resources available for you that you're able to download in the handout section to your right. These links are accessible and they will link you to our website. So if you want to get a CHW training and consulting, you can go to our website and do that. To obtain the web model, you can also obtain those results. And the career web is also available for you to review and utilize at your convenience on determining what does the future of your career look like. Next slide. So we want to thank everybody for participating. These are our contact information. If you have more questions or need more information on the career web model that we've developed at MHP Salud, please feel free to reach out. We'd be happy to help. And thank you again for attending our session.
Thank you, Monica. There's a couple questions in there. You got about 4 more minutes if you want to take a look at that question pane. Should be a couple questions that we need answered. Oh, I think you're muted too as well right now.
Sorry.
You're good.
Okay, let me see. So we have one question, right? Or is there, I just see one question.
Okay.
The question states, can you share why a career ladder wasn't built that focuses on a CHW staying within the profession and not pursuing other roles? There was, we didn't include it in this presentation. You will find that we did this presentation on focusing basically the mobility within other roles, but we do have those models within our platforms for CHWs that want to continue further training within their CHW roles. And you will find that in the website.
We do have another question from Katina asking, how about school nurses and counselors in the educational path?
That was not part of the study. We don't have those, though I wouldn't be able to share those results. I don't know, Jose, if you know any information on that.
Well, I wouldn't have any additional information on that. I know, of course, CHWs are able to make those referrals as they would be a great resource, but I do not have any additional information or correlation with the school nurses with CHWs. However, I do see within the career web that we do have registered nurse on there as well. So that could be one of the part of that role, but we don't have more information specifically on these two roles.
But it's a great question, and we'll take that back to our resources.
And for our last question, can you talk a bit about the difference between a health educator and a CHW?
Jose, you want to answer that?
They for these roles, it can be looked at really similar. I mean, CHW has the role has so much flexibility. Of course, CHW can be a health educator. If someone is just solely just a health educator on a certain topic, I believe that may differ a little bit. I know CHWs are able to engage in several topics within their community, whether it could be based on a program that they're participating in, such as diabetes, nutrition, or anything like that. But I think you can intertwine health educator and a CHW that also does health education. So there's a lot of flexibility within these roles.
Okay, thank you.
Thank you.
And I'll go ahead and transition it over.
Okay, thank you, thank you. All right, well, hello everybody, and welcome to the session, our presentation, the Community Health Worker Common Indicators Project, Engaging CHWs in Measurement to Sustain the Profession. It's a pleasure to be here with you all today, and I hope that you are enjoying the conference so far, that you found value in the other sessions, and that we can add to that for you. I'd love to let my co-presenter introduce herself and before we get started.
Awesome. Keara, thank you so much. And my name is Victoria Adewumi. I am a community health worker based in the Manchester, New Hampshire area, and I've been part of the CI project for just about 7 months now. I can't believe it. Time has flown, and it is such a pleasure to be here with you all.
Thank you, Victoria. And my name is Keara Redela. I use she, they pronouns, and I'm a community health worker. I've been one for about 7 years and been on the leadership team of this project for about 2 years now. Time does fly. COVID. This is my time, right? It's been a pleasure. So what we are going to do is look at just objectives. If I can get the next slide of what we hope to cover in this short time we have with you. Thank you. So what we want to make sure to talk about include, by the end of this presentation, you all understand the benefits of collecting common indicators, for CHW practice, and be familiar with the history, aims, our current status, and recommended indicators of our project. Know how CHWs have been engaged in the project since its inception and how that engagement's deepened over this last couple of years. And explore how you all might be able to use common indicators and advance CHW engagement and evaluation in your own settings and programs. I get the next slide. So we're hoping to achieve those objectives through this agenda. We already did introductions. We're gonna talk about the value of collecting common indicators, go over those key activities, priority indicators, apply, and then talk about applying the common indicator and the CI approach. And if we have time, ask you all how we did with the evaluation. Next slide, please. Okay, so for what we're gonna do is our best to use popular education in this setting. What that means is we're going to start with what people already know and value it. We're going to come to the space realizing that everyone's a teacher and everyone's a learner. We're going to pool our knowledge. We're using it to create a more just society, and we want to balance participation and power among the room. This is why we love Puppet. This is why we use popular education, and we're going to hope to do it in this virtual setting with you all today. So go ahead to our next slide, please, our next activity. I'll give it to Victoria.
Awesome. Thank you so much, Keara. And I love that our previous presenters referenced people's education so fantastically. So we're hoping to build on that practice with you all. And like my fantastic co-presenters said, that one of our main ideas is that no matter who we are, we know a lot, right? We've had experiences, we have had education in various formats, and that has contributed a lot to our individual learning. And so we begin, like Keara said, with what you already know. And so to find out what that is, I would love to introduce our Dynamica, our brainstorm, and it also hopefully will give you a chance to hear from people besides myself and Keara. So we'll stop the screen share for just a moment, and I am going to present a brainstorming question. So I want you to think about this for a moment, and then do me a favor, raise your virtual hand. You should see that icon in your menu pane next to your microphone icon. If you don't see it, you'll also be able to put your contribution into the question function, and we'll be able to read them out from there. So our brainstorm question, you can see it, is why might it be valuable to collect common evaluation indicators for programs that employ CHWs? So I'll give you a minute to think about it, and then we'll start seeing either responses in the chat or in the question pane, and or if you are feeling brave in this session, you can raise your hand and we have our amazing tech team who will unmute you. So I'm going to check the chat. So I've got someone from Margarita saying demonstrating effectiveness. Absolutely. I've got showing national and statewide data. 100%. So important when we're thinking about our CHW programs. Helping to secure additional funding. We will absolutely be talking about that during our presentation. I'll take a couple more. The ability to quantify what we're doing for policy change, to prove the value of our work so we can grow the profession. Absolutely. And to address knowledge gaps. You guys are already common indicators experts, clearly. I have a couple more key points on the CI project that I would love to illustrate for all of you, just sharing some basic information, even though we clearly have such a depth of knowledge in our Zoom, or excuse me, in our presentation room. We can go to the next slide, please.
I have a couple hands raised. I'm gonna.
Oh, we have some hand raised. Absolutely. If we could have some folks unmute and share, that would be wonderful.
So I have unmuted Anna. If you could unmute yourself.
Victoria has already read what I had to say. I was going to mention quality improvement.
Oh, okay.
That is fantastic. Quality improvement. It's such an important idea, especially when we're thinking across programs. Thank you so much for being brave and sharing that, Anna. Any others?
I don't see any others right now.
All right, fantastic.
I think everyone
as I always say in presentations, shout me down if you guys want to interact with us. If you have a question, we would love for this to be as interactive as possible. So, talking a little bit about the history of the CI project, if we could go to our next slide, we have had always, when we present the common indicators, the first question people ask is why? Why is this important? And again, the responses we've received so far really illustrate it, right? That number one, we believe that common indicators facilitate aggregation of data, right? This is the collection and presenting in a summarized format for analysis across programs and regions. This is how we as CHWs demonstrate the effectiveness of our workforce and of our programs, which, as many folks have already highlighted, absolutely increases the likelihood of sustainable funding. And number two, equally as important, measurement drives practice, right? We can't change what we don't measure. And once we measure something specific to our CHW programs, these are the things we'll focus on and prioritize. So if we want the most effective CHW programs possible, we know we need some level of measurement. And for us at the CI project, we delineate our measures into two groups. Our process measures, so these are the unique skills and qualities that CHWs have, and then our outcome measures. This is how the lives of our clients are improved through their working with us. Next slide, please. So you are either have or about to see, there we go, the history of our project. There's a lot to take in on that slide, but I want to highlight a few key points. The first is that this was a CHW-led process that got us here. We believe and are demonstrating that the indicators are applicable to your CHW program because they were created by and with you, with CHWs, deciding what we want to measure in relation to our profession. It was a coming together of CHWs, allies, researchers, stakeholders, all of it in an intensely collaborative process. And not to toot our own horn, but we're picking up a little bit of steam that we're proud of. We've had 2 peer-reviewed publications in the last quarter, and we have had an absolutely incredible time with our pilot sites, the folks on the ground piloting these indicators for the first time, which we'll be discussing shortly. So I'll pass back the microphone to you, Keara.
Thank you, Victoria. That was lovely. So another main idea of popular education is that we all learn more when we are actively engaged in our learning. For that reason, we use various dramatic techniques. Today, we're going to use one called a sociodrama, which is a short play enacting a real-life situation. And in our sociodrama, I'm going to play myself, Victoria's going to play herself, and the setting of our sociodrama is Victoria and I on a Zoom call. We're meeting to prepare for a presentation at the 2021 Udemy conference. You ready, Victoria?
I'm in character, I'm ready.
Okay, here we go. Victoria, I'm so glad we were able to find some time in our busy schedules to prepare for this presentation at Unity.
Me too. It's so good to see you, Keara. And as I understand it, we are wanting to focus on the work the CI project has done in the last couple of years and also highlight how the project has centered the leadership of CHWs, you and I, right? Is that correct?
Yeah, you got it. So you joined the leadership team in August of 2020, right in the middle of the pandemic.
Yes, quite a bit has happened since then, if you'll recall. But remind me, what had you all done the year before myself and Penny and Susan joined our leadership team?
Sure, yeah. So as you know, the National CI Project has existed since 2015. In 2019, we received funding from the CDC, or the Center for Disease Control and Prevention. The purpose of our funding in 2019 was to choose 10 priority constructs or concepts and develop specific indicators to measure those constructs.
Okay, so you needed to figure out how to measure the constructs, right? So what was that first step?
The first step was to choose the 10 priority constructs from our existing list of 20, and we did that along with our partners from the CDC.
Wow, was that a difficult process?
Not really. Basically, CDC folks suggested 5, we suggested 5, and at the APHA annual meeting in 2019, pre-COVID, we asked a group of stakeholders if they were happy with the 10, and everyone agreed with the list. Go figure.
Oh my goodness, if only everything in life, Keara, was that easy. So I have got a list going, and let me make sure, can you see my list, Keara? Can you see what I'm working with?
No, not yet.
Okay, no, it's totally fine. I'm having some tech issues, but no worries. I'll read it out to you.
Yeah.
Oh, there we go. So we've got the process indicators, which I'm pretty sure are all about CHWs, right? So these are our compensation and benefits, as well as opportunities for advancement, whether we're playing, a full range of roles, the referrals we make, how much we're involved in policymaking, and how well that we're integrated into teams. Whereas the outcome indicators, those are about our clients, right? That's their self-reported physical, mental, and emotional health, their health and social needs, their level of support and empowerment. And as a bonus, there's an indicator for policy and systems change at the program and state levels. This is such an awesome list. So once you've got these indicators, what happens next?
Well, okay, we did do a literature review.
Ooh, it's a bit of a sore subject, Keara. You know, I'm back in school. Been doing quite a few of those recently. Anyway, I can imagine that. What happened after the lit review?
Well, okay, once we finished the lit review, we came up with proposals for how to measure the 10 constructs. Then we vetted those proposals with our stakeholders.
Okay, well, tell me a little bit more about the stakeholder part.
Well, the most important stakeholders are our CHWs, our CHRs, our promotores de salud. The stakeholders, though, also included like CHW researchers, evaluators, state health department staff, and people working in health systems. Based on that input, we finalized our performance measures, which provide lots of information about how to measure the indicators.
I feel like we're finally caught up in the timeline. This is where myself, Penny, and Susan joined the CI project. So I know this part. This is when we started choosing our 4 pilot sites, creating a manual with the information and the tools those pilot sites would need. And then by the end of April of this year, we were ready to start piloting those indicators.
Exactly. So through an application process, we chose our 4 pilot sites, and they were in Wisconsin, Michigan, Arizona, and Maryland.
Awesome. And I completely remember that meeting when Penny suggested having one of us, one CHW from the leadership team, work with each pilot site.
Yeah, that worked out really well. Tell me, Victoria, what caught your attention when you were working with your pilot site?
The folks in Maryland are so awesome. I'm always blown away with how connected they are. They have an incredible champion in that organization, and it has led to such a cohesive and high impact team.
That sounds similar. I got to work with CHWs in Arizona, and the thing that I noticed was the health system there, the CHW association there, the PRC there, even in the CHWs all had this really strong bond. So as we were trying to figure out what does this really look like for the CHW to use the indicator in their intake forms, they gave us feedback. All of the upper leadership management were like, okay, so then let's change it. How do we fix this? How do we make it work for y'all? And it was just beautiful to see, actually.
Yeah, absolutely. I couldn't agree with you more, Keara. And another thing that has just impressed me so much about this project is the way that CHWs and CHRs are centered in every step of the process.
Definitely. So as a CHW, that part was really important to me when I was thinking about this project. Yeah. In 2020, we increased the number of CHWs on the leadership team, making it 50 CHWs, 50% allies. We created the council made up of 4 additional CHWs who provide input on decision making, and just because we know how valuable, right, how important our voice is.
Absolutely. Again, these are such incredible people in this council. They are such a pleasure to work with and to learn from. It's been an incredible experience.
Yes, I agree. There are also so many CHWs on our advisory group, and anyone who's interested in joining the advisory group, which we meet bi-monthly, is able to join. I love that it's open, that we are still recruiting and always open to people joining us. And I really like how in those meetings, everyone has a chance to express their opinions and help direct this project.
Awesome. Phew, I feel like I finally am getting my head around what we're trying to do here, Keara. I feel so much more prepared for our presentation at Unity.
Me too. Okay, so how about we start working on the PowerPoint?
Awesome, let's do it. Scene. You all can now throw tomatoes or give us our flowers, depending on how that acting performance was.
Exactly. So may I have, oh, there we go. Okay, the slides are up, and what I'd love to ask, what I'd love to put out to y'all is just the question, thank you, what caught your attention on the sociodrama? Please feel free to raise a hand or drop it in chat. What caught your attention?
And I am checking the questions. And also, again, if you're feeling brave in this session, please raise your hand and our incredible tech support will call on you to unmute yourself.
Do we have any?
We're getting some affirmations that our acting performance was not too terrible, so we appreciate that.
Okay. Well, no hand. All right. Well, what we can do is just go ahead and recap just some key points. If I can get the next slide. So, key points we want to make sure everyone was able to see and understand are the indicators that were identified through this last year work with the CDC. The process indicators were shown earlier, but we wanted to make sure we realized these are the 10. These were identified, like we mentioned, through a process. We vetted it and we brought it back to stakeholders, which included our CHWs at APHA. Our whole list of 20 all came from talking with CHWs, stakeholders, allies at various APHA conferences, at our summits. So these are being lifted up, highlighted in and identified and implemented because of CHW voice. CHWs have been involved from the start of the project. The leadership used to have 1, now we have 3, which is amazing. We have our CHW council and hoping to expand more on them being involved as we get more additional funding, but that's been beautiful to have those additional voices as well. And if you want to be involved in the project, if you at either the advisory council or just have questions, we do have the chwcommentindicators@gmail.com email. You can always reach out to learn more, to get more information and or get questions answered. What I would love to do is say thank you for paying attention. Thank you for humoring us, and then open it up if you all have any questions on our work or on what's been presented that we might be able to answer for you in these last few minutes.
Yeah, that's perfect, Keara. And in the last few minutes, just like you said, you've got a reflection question on your screen. So how you can imagine engaging CHWs in measurement for your programs, right? You've just watched the sociodrama. And when we think about popular education, we want to make sure you have the opportunity to immediately apply what we are learning together in your own setting. So think about that question for just about a minute And then in the time we have left, we'd love to hear from you. How do you imagine engaging CHWs in measurement? And again, feel free to use the question function or raise your virtual hand and be called on.
Looks like we have a couple questions. Are there indicators we should always measure and or keep in mind for a new program?
That's a fantastic question. I'll start and then I will hand the mic back to Keara. We love the set of 10 because we think that they are together a really comprehensive and robust way to assess CHW programs. But where we always recommend for folks to start is what you're already collecting. So the vast majority of CHW programs are doing some level of measurement. And so in order to not overburden your team with asking a whole bunch of things in addition to their regular workload, we love beginning with where you're already at and then growing from there. And every program prioritizes different things. So really feeling for your organization what's best for you, what you're already measuring, and based on your goals, the specific areas you'd like to grow in. Any other thoughts on that, Keara?
You covered that really well. I would think with the capability of what you can collect. So do you have system, thinking of what systems you have in place. Are you going by paper? Are you doing electronic? Thinking through all of those kind of and match it with what questions or what indicators you might be able to implement. As you said, what you're already collecting it, don't burden your systems. How can you make them work together? Because if they work together, it'll be easier to collect and you can get buy-in from your senior management and your managers.
Okay, another question we have is, do you have suggestions or further information on what tools you can use to get to the CI?
Will you say that question one more time?
Do you have suggestions or further information on what tools you can use to get to the CI?
Absolutely. So if you're interested in learning more about the indicators, like Keara said in the sociodrama, that we have an advisory group that meets monthly, and we would so welcome additional support and input from all of our communities to be part of that process. If there is a specific question that you all have, we also would love for you to email us at chwcommonindicators@gmail.com. And there is our specific indicator grid that we are more than happy to share with sites. And so if you're interested in receiving that as well, again, you can email us at chwcommonindicators@gmail.com, and we would love to share that resource.
Another question we have is, can you speak about the role or adaptations to patient-reported outcome measures for promoters/CHWs?
I'm passing this one to Keara.
No problem. Will you repeat it one more time to make sure I understand the question?
Yeah. Can you speak about the role or adaptations to patient-reported outcome measures for promoters/CHWs?
Adaptations. So not quite sure.
And I'm wondering, not to jump up in front of you in line, Keara, but just I'm wondering if this question is asking if you already have a specific tool that you're using to measure outcomes, and you're just wondering if this could be tweaked or adapted. So if that's the question, and please put clarification into the question, not quite it.
So we haven't.
We are actually working with sites currently, and that's exactly what they did. They took what they're using either in their clinical settings or in other settings, and either swapped out a similar question for one of our questions or added one of their questions. So I'm not quite sure if that's what folks are asking, but I hope that gets close to it. Anything to add on that, Keara?
There's not, so the measures we have, there's none that we adopted per se, because we understand that every program is different. Every program is asking different things. So like you mentioned, they may have swapped out a question that we have, but we haven't adapted or changed any of the measures. We do have a colleague who's working on that, which we can share out more information. If you go ahead and send us that email, we can talk about that in more detail.
Okay, thank you. I think we're at time for today's session. I want to thank the presenters, the speakers, and the attendees for joining, and I hope you have the rest of your day.
Thank you all. Bye.
Thank you guys. Have a great day.